putting your weight this way.
Right, sit back down. Sit back down.
Let's just take the stairs.
Kirsty, sit back down.
We can do it.
Kirsty, come on.
Let's go.
My name's Amy. I'm a vestibular physical therapist, which means I treat dizziness and vertigo conditions just like these every day. The person in that video is named Kirsty, and she has given me permission to share her video and talk about this case specifically on my page. Now we can tell from her postural reactions that she feels a really hard pulling or spinning off to one side. So hard, in fact, that she's pushing against the people who are trying to help her walk straight. We can't really tell exactly what side it is because we don't know if they were using a front-facing or back-facing camera, but it looks like the right side from what this shows, which means the right side is probably the affected side. About 4 days into suffering with these vertigo symptoms, she tried something called an Epley maneuver to fix her vertigo symptoms. She did a couple on the right ear, and then as this one showed, she also tried one on the left ear, and all of them failed to resolve her vertigo symptoms. The reason why the Epley maneuver and no other maneuver was going to work for Kirsty is because she did not have what that maneuver treats, and that is BPPV. BPPV stands for benign paroxysmal positional vertigo, and it causes vertigo symptoms by having calcium carbonate crystals, which are supposed to be secure inside your ear, break loose and then go free tumbling inside your ear canals, thus hyperstimulating one ear and making you feel like you're falling to one side. Although this is a very common cause for vertigo symptoms, it is not the only cause. It turns out Kirsty was actually afflicted with something called vestibular labyrinthitis or vestibular neuritis. This is a condition where the inner ear gets super inflamed as a result of a viral or a bacterial infection. Although Kirsty's presentation of a sudden, violent onset of vertigo can look like BPPV, it also looks like the acute phase of vestibular labyrinthitis or neuritis. The way that doctors would know that it's labyrinthitis or neuritis instead of BPPV is she would test negatively for BPPV. We do have tests that tell us if it is BPPV or not. She also would not respond to those maneuvers that we mentioned earlier. And people with neuritis or labyrinthitis tend to have a buzzing sound or a fullness feeling or some hearing loss in the affected side as well. Typically, the disease process of vestibular labyrinthitis or neuritis is the acute phase, which lasts between 1 and 3 days, where you're in this particular state. You can't stand up, at least not without help. Most people are bedbound, and some people are vomiting nonstop. But after the acute phase is over, most people become very functional. They can move around and get back to daily life, but they don't feel quite normal and free of dizziness and imbalanced symptoms for between 6 and 12 months. Treatment for this condition involves a lot of time spent healing. Also, doctors can give you medications that help manage the symptoms, at least in the acute phase. If you catch it quickly enough, an antiviral or an antibiotic can help, but only if you catch it really quickly, and most people do not. Vestibular rehab can help a lot with recovery times and to help your brain and your ear talk a little nicer to each other a little more quickly after the episode. Overall, I want to thank Kirsty for sharing her story. It is a very vulnerable place to put yourself in, to be that sick and put yourself on camera and put yourself out there on the internet. The people on my page really thank you for this learning opportunity, and I wish you a speedy recovery.